Edutainment Studios welcomes you to Age-Related Macular Degeneration, Understanding It and Living with It. This module is part 1 of a 5-part series on age-related macular degeneration. In some people, AMD, or age-related macular degeneration, advances so slowly that vision loss does not occur for a long time, while in others, the disease progresses faster and may lead to a loss of vision in one or both eyes. As it progresses, a blurred area near the center of vision is a common symptom. Over time, this blurred area may grow larger, or you may develop blank spots in your central vision. Objects also may not appear to be as bright as they used to be. AMD by itself does not lead to complete blindness. However, the loss of central vision in AMD can interfere with simple everyday activities, such as the ability to see faces, drive, read, write, or do close-up work, such as cooking or fixing things around the house. In this course, the objective is to help you understand the basic information about age-related macular degeneration. Learn the 2 types of macular degeneration. Age-related macular degeneration is an eye disease that usually occurs after the age of 60 in both men and women. It can progressively destroy the macula, which is the central portion of the retina in the eye, which, once affected, impairs one's central field of vision. Age-related macular degeneration is also called AMD or ARMD, and rarely causes blindness as it only affects the center of vision. However, injury to the macula in the center of the retina can impair the ability to see straight ahead clearly, as well as make it difficult to read, drive, or perform other daily activities that require fine central vision. The macula is in the center of the retina at the back of the eye. As we read, light is focused onto the macula, where millions of cells change the light into nerve signals that travel to the brain and tell it what we are seeing. The health of the macula determines our ability to read, recognize faces, drive, watch television, use a computer, and perform any other visual task that requires us to see fine detail. Macular degeneration is the leading cause of vision loss among older Americans, and due to the aging of the U.S. population, the number of people affected by AMD is expected to increase significantly in the years ahead. Macular degeneration is diagnosed into one of 2 forms, either dry or wet, also known as non-neovascular or neovascular. Neovascular refers to the growth of new blood vessels in an area where they are not supposed to be, such as the macula. The dry form is more common than the wet form, with about 85 to 90% of AMD patients diagnosed with dry AMD. Dry AMD is an early stage of the disease and may result from the aging and thinning of macular tissues, depositing of pigment in the macula, or a combination of these 2 processes. Dry macular degeneration is diagnosed when yellowish spots, known as drusen, begin to accumulate in and around the macula. It is believed that these spots are deposits or debris from deteriorating tissue. Gradual central vision loss may occur with dry macular degeneration, but is not nearly as severe as wet AMD symptoms. However, over a period of years, dry AMD can slowly progress to late-stage geographic atrophy, or GA, which is a gradual degradation of retinal cells that can also cause severe vision loss. No FDA-approved treatments are available for dry macular degeneration, although recently there are a few being investigated in clinical trials. Currently, it appears the best way you can protect your eyes from developing early or dry macular degeneration is to eat a healthy diet, exercise, and wear sunglasses. It is important to protect your eyes from the sun's harmful UV rays and high-energy visible, or HEV, radiation. In about 10% of cases, dry AMD progresses to the more advanced and damaging form of the eye disease, wet AMD. In this form, new blood vessels grow beneath the retina and leak blood and fluid. This leakage causes permanent damage to light-sensitive retinal cells, which die off and create blind spots in central vision. Choroidal neovascularization, or CNV, the underlying process causing wet AMD and abnormal blood vessel growth, is the body's misguided way of attempting to create a new network of blood vessels to supply more nutrients and oxygen to the eye's retina. Instead, the process creates scarring, which sometimes leads to severe central vision loss. Wet macular degeneration falls into two different categories, occult and classic. In the occult CNV form, new blood vessel growth beneath the retina is not as pronounced, and leakage is less evident, which typically produces less severe vision loss. In the classic CNV form, the blood vessel growth and scarring have very clear and delineated outlines that can be observed beneath the retina. This form usually produces more severe vision loss. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 1 of 5 on age-related macular degeneration, and please join us for Part 2.